I think if you're working on an environment and you have an idea of how to make it better, then absolutely a quality improvement process is the way to go forward. At this trust, we're fairly lucky. In Northumbria, we have the Quality Improvement Council, which allows you to submit an idea through its website portal, and that idea then is adopted, and there's certain levels of support available depending on the idea. But if you've got the idea, I think the best thing to do is first take it to people who can make it happen. So if you're a junior nurse or junior pharmacist, then go and speak to your line managers or your team leads and discuss that with them. Take it to other members of the trust and start building your team, your network of people who will help you deliver that idea. The most important thing is not to give it up, and because you think it's too complicated or people or you don't have the skills to do it. With quality improvement, you almost can start building those skills as you undertake the project, which BMG Quality is also good for. The project we've just finished with the Health Foundation, the SHINE project, is very different to what's been done before. This resident involvement aspect of the project is quite unique, quite innovative, and it would not be right to just sit on that data and not share it with people, because by sharing it, by showing people how we've done it and sharing our approach to our models that we've developed, they can then do it, and it can only be a good thing. So sharing is vital, just not from a personal point of view. It's nice to have publications, it's nice to have your name in print, but from a ethical point of view, where you have to, where it's important that the interventions you've developed can be taken up by other people and delivered for the care of patients elsewhere across the country or even internationally. Lifelong QI is a great concept. It's, every professional is used to continual professional development. As pharmacists, we've done it ever since I've graduated, and it's important. And I think lifelong quality improvement is important. I think services don't stand still, and you need to continually improve. If you look at the motor industry or other industries like nuclear, they don't just do one thing and do that thing the same way forever. They're continually improving, continually learning, and using that learning to make changes. And that can only be a good thing for patients. I think it's fascinating. I love it. I've really got into quality improvement. I'm quite new to the science. My background is research, and it's very different from research. It's a lot less rigid, a lot less fixed in what you can and can't do. With quality improvement, it's more like real life. It's what you would do anyway. It's almost common sense, which is why I believe anybody can do it, and it should be built into people's job roles, and people should be enabled to think this way. Quality improvement isn't complicated. It allows you to look at what you do now, look at the bits that aren't good, and helps you make those bits better.